Good morning, everybody. Thank you for watching Taxes Made Easy. Today we're going to focus on a fairly complicated topic, and that's healthcare. How does healthcare affect average individuals like yourself and also affect your taxes? So, not sure if I have my microphone down. So, again, we're going to be talking about the ACA. We're going to talk about other healthcare plans and options as well towards the end of this. But one of the biggest things that helps people, there are still penalties or subsidies. If you don't handle your subsidies right when you apply for the exchanges, people are still having that added to their tax bill, and the government is collecting on that. It's still hurting a lot of people. So the original ACA penalty hasn't been around for years, but people are still getting burned by these exchanges and these subsidies. So we're going to dive into that in depth today, and stick around. This will be a great show. Welcome back, everybody. Thank you for watching live or on rebroadcast on the smartmoneyculture.tv. This is a big topic we're tackling today. It might turn into two shows. But again, first of all, we're going to try to walk through it, explain it. I get calls all the time where people are just blindsided by how healthcare in America works, especially if they're immigrants, but also people that don't understand how all of a sudden they have to pay these huge subsidies back, and it gets added to their taxes and the tax impact. I got a call 2 days ago where someone was very concerned they were going to lose their home over this. So again, this is good information to have, so and understand, and not only what are your options in dealing with some of these subsidies or taxes, the healthcare taxes that get added to your tax bill. So again, stay with us. But first of all, we're going to jump into some news. There's some important news. So we were talking a lot about the Brooklyn Bridge last week, and this is national news, even international news. It was a big deal. Again, that collapse of the bridge is going to have a huge impact on that area economically, probably for 12 to 18 months, and there will be lasting effects from that. I mean, people commuting, trucking, shipping coming into that harbor is going to be definitely affected by what happened. That was a very big deal. We all probably remember about 6 months ago when we had those wildfires in Hawaii. So again, this is another example of the IRS announcing a pause on interest, a pause on filing deadlines. And so this is another article today extending out filing deadlines to August 7th for anybody in Hawaii County, and I believe Maui and Hawaii counties. So again, this is straight from the IRS newsroom. You can just go right to irs.gov, click on news, and this is the top article. Again, they have a few different ways that they help, and they have quite a few different deadlines that have changed to help people that were in those horrible wildfires or in the counties affected by it. So again, the wildfires had a huge impact. Anytime you have a serious issue or something that happens in your area and it's declared a disaster area, it's not just done. Not everybody's affected, but the economy is going to be affected. People are going to be affected, and be very aware of those changes in tax deadlines. So again, you can get that information directly from irs.gov, or you can Google it. Again, it is not an uncommon occurrence to have disaster areas declared, and then the IRS will make adjustments accordingly, and give people more time. Unfortunately, in some situations like wildfires, records are gone, and there's, again, a lot of records were just burned up. That's why if you're a business, you should keep your records in a digital format and you should have either an offsite server or cloud service or something like that, where if you lose your pace of business, you lose your service, you lose all your paperwork, you can still file your tax returns. Your information is still accessible. But that's another topic entirely. So, second story I want to focus on, and this is BlackRock. So, it was an interview that the CEO of BlackRock did on CNBC. And so, whatever you want to know what's going on in the economy, what to expect, look at what the financial companies are doing. And not the ones that are getting in trouble. Like when we had 2008, you had people over investing like crazy and overextending themselves, and then all of a sudden everything crashed. But look at the people that are commenting about the economy, the people that are kind of sounding the warning bells. Hey, what's going on? This is something to be concerned about. And in this interview, CEO Larry Fink of BlackRock wasn't exactly ringing the warning bells, but he was talking about inflation. And he's convinced that inflation is not going to go down anytime soon, that it is going to continue to persist. And I agree with that, because the underlying pardon me, the underlying drivers of inflation haven't changed. What's truly driving inflation? Our monetary policy. Have we done anything different at the federal government level rather than raise interest rates? No. You keep borrowing, you keep adding fuel to the fire by more and more money to the system without productivity to match it. Inflation is going to continue. That's the biggest driver of inflation. It's not, normally when you have crazy high growth, then you get inflation with it, but it's not being driven by crazy high growth. That's not what we're seeing. Unemployment is still being stubborn and persistent. It's our monetary policy. And again, it's Democrats and Republicans. It's both parties doing the same thing, continue to play the same game. So that's why, and that might be on the fringe here, I would rather see a fight in Congress. The can is always kicked down the road. Same thing with Social Security. It's Republicans and Democrats both sign off on this. Let's not eat some political hay. Now, we don't want to endanger our own political future, rather than do what's right for the country and actually tackle some of this fiscal insanity. So going back to this interview, it's interesting that the BlackRock CEO, Larry Fink, he says, well, it's not so much a bad thing that we have inflation, because we have food is going up, wages are going up, everything else is going up, but most of the wages increases are due to you have to retain people. People are trying to survive, so wages are trying to keep up. In California, they just announced $20, or it's about to go into effect, a wage increase to $20 an hour for fast food workers. So guess what all the fast food companies are doing? Firing workers en masse. So a lot of them, what they're doing is they're firing all their delivery drivers, and any delivery service will be done through Grubhub, and all the food delivery services. I don't typically use them, so I'm not familiar with them that much. But again, there's always a reaction to every action in the economy. There's no free lunch. Whenever you do one thing, it's going to affect others. So there's this interesting comment. I'm just going to kind of read this. So this is Jim Cramer was the host. And he asked them, how do we convince them? Like we were convinced by our parents that we were going to make more than they did. I knew from day one, my father said to him when he was a child, you will make more than I do. And that's what's going to happen to you. I had every Thanksgiving, you're going to make more than I do, my kid. No kid I know thinks they're going to make anywhere near what our generation did. And that's the biggest concern here. What Jim Cramer was saying in this interview to the BlackRock CEO, Larry Fink. with ongoing inflation, it eats everybody's lunch. It eats into retirement savings. It prices homes out of the reach of future generations, and the increase in homes and costs have just exploded. We've talked about a bunch of different ways how it has exploded, some of the reasons why, and how it affects your taxes, because it all comes around and hurts your wallet. And so, one last thing I want to touch on before we dive into this, and this is from ABC News. This is a really good article. I'm actually going to share this one. This is specifically for small business owners. And again, this is tax changes small business owners should be aware of as the deadline looms. So tax filing deadline is coming up April 15th. And it is important to have, to know how things can affect you. So they suggest filing an extension rather than just filing your taxes. You can always file an extension. Most people file extensions. If you're not ready, if you don't have all your information, file an extension. But again, the caveat here is pay your taxes timely. And I'm just going to kind of skip through this article. I recommend, if you're a small business owner, go and read some of this. It gets a little bit into the weeds. It's a little bit longer. Again, this just came out yesterday morning, and the original articles from the Associated Press. But again, this is, you have the March 15th. This was the deadline for some quarterly taxes. April 15th. There's a lot in here. One of the big things they say is, again, due to these changes, you're losing money if you're not taking advantage of all the changes here. If you are, again, you think you have a simple business, you should at least have a bookkeeper. You should at least be running it by someone to make sure that your taxes are done correctly. And it should be, honestly, it should be a tax professional, someone that has been doing this 10, 20 years. It should be someone that has a lot of experience. And there's plenty of CPAs that are just as affordable as even using TurboTax. Because when you become a business or you have a bunch of extra schedules, TurboTax, Jackson Hewitt, Liberty Tax, they're just as expensive as most CPAs or many CPAs. There are CPAs that, again, they're really good. They're in high demand, so they charge a lot more. But I know plenty of excellent ones that still charge reasonable rates. And sometimes if you have a very complicated case, you need those better CPAs, and I refer to them as well. So again, there's a bonus depreciation here for capital purchases. She goes into it. For startups, there's R&D changes, research and development write-offs. And again, this is affecting large and small companies. But again, here's the key part. Small businesses are hurt the most by some of these changes. So if you're just doing everything without understanding the changes in the law that happened over the last year, there's a big reason for that. Underpaying your taxes will cost more with penalties and interest. They estimated it was around 3%. The base rate was 0.05%, and that's what's jumped to 8%. I've been hammering on that. That again, the failure to pay estimated tax payments is going to hurt small business owners more than anybody else because they're not aware. They like to pay at the end of the year. This is not, it's going to surprise a lot of people. It's going to hurt a lot of people. Again, they talk about the employee retention credit and how the IRS is going after this. This is calling them an industry of scammers isn't exactly fair. Congress created this situation, and of course, this cottage industry popped up. This is what happens. This isn't a surprise. And I've met people that were promoting ERC and doing this work. Doesn't mean they're scammers. But again, this is how the government's looking at and treating these people, which is a bit unfair, in my opinion. Do I agree with everything they're doing? No. But do they help a lot of people get a lot of money from the government? Yes. And now the government's coming and trying to claw that money back. So it's not exactly as one-sided as the government tries to portray it. Again, a lot of information here. They need to be able to keep accurate records throughout the year, and keeping those records so you can do regular profit and loss statements. Look at how your business is doing is absolutely key, and I over time. So we're going to be right back. Welcome back, everybody. Sorry, I got a little carried away by that last article. I'm just going to go ahead and screen share it one last time. You should read through it as a small business. Again, this is ABC News. Tax changes small business owners should be aware of as the tax deadline looms. Came out yesterday morning. Again, the original writer, May Anderson, with Associated Press. So there's a lot happening. There's a lot affecting small businesses. And part of what I'm trying to share is that you should be informed. Be informed, be aware of what's going on and how it's going to affect you and your family, if not your employees. So again, that's why talking about healthcare really affects all of us in one form or way. There's everybody needs some kind of health insurance plan. There are plenty of people that just go by the seat of their pants and I'm healthy, I never get sick. And when I was young, can't say I didn't do that. But again, things as you get older, health insurance is very important. So, pardon me. Historically, for those people that weren't buying health insurance in the last more than 10 years ago, and it's been 10 years, kind of eye-opening to think that it's already been 10 years that we've had ACA or Obamacare in law. But again, it was fairly affordable and reasonable to go get health insurance. Raising my family, we grew up in California. We had Kaiser Permanente insurance, which actually hails back to World War II. It was an insurance first offered to the shipbuilders in the ports around the Bay Area and throughout California. So it's a product unique to Western states. And Kaiser had its detractors and people that liked it, but essentially it was a one-stop shop. You paid a flat fee, but you just had to work within the Kaiser system, Kaiser doctors. And so very few copays, very low. We had 3 children, paid very little for each pregnancy, and we loved it. We loved it. They took care of us for the most part. There are times you had to be a little consistent to get what you needed, but they're a little persistent. But overall, it took care of us. Over the years, the cost of Kaiser, with more and more changes, went up and up and up. Today, it's just as unaffordable as any other health insurance. So when I say unaffordable, if you go directly to a health, this is private insurance. What's happening with private insurance? Is it still out there? Yes, it is. It is just very expensive. So they have every plan now. You could go and just get a very basic plan that cover the basics. If you want a maternity coverage, you could add it. You pretty much picked and chose what you wanted to add to your insurance. But the problem was when people would have pre-existing conditions, it would be very hard for them to afford it. Again, it was very expensive for people that already had very expensive issues. And so most of the people would go on to Medicare or Social Security once their assets were spent down. So the idea with Obamacare is to insure more people and get them on. So just to kind of be fair here, because to be fair, I am a little biased when it comes here. And this is not meant to be a political discussion. This is meant to help inform people and help people make wise decisions. So again, I'm gonna screen share again, and we're gonna go directly to the government. This is U.S. Department of Health and Human Services. And again, there are things that were accomplished, plenty of things that were accomplished with the ACA plan. And this is a fact sheet that was put out recently by the government, well, March 8th, 2022, celebrating the Affordable Care Act. And so I'm not going to go through all of this, but it required women's preventive health services, birth control, counseling, well woman visits, breast screening services, and the idea that if everybody had the same plan, health insurance would be more expensive for women. But that means if you're a guy and you go out and you get health insurance, you're paying for maternity care, even though you're never going to get pregnant. You'll have to deal with the cost of being pregnant unless you. No, still don't think that's possible. It expanded Medicaid eligibility up to 138% of the poverty level. Basically, they went and they took. There were about 20% of the country that was uninsured, and they drove that number down to 9%. So a lot more people have health insurance coverage today, or some kind of coverage. So there's a pregnancy assistance fund, maternity health. I'm just going to kind of skip this. I'm not going to walk through this. More coverage for older adults, which is where a lot of people were suffering, and people with disabilities that aren't able to take care of themselves. Personally, I think we need more, especially for people with disabilities. Historically, as a nation, we have not taken care of people with disabilities, people with mental illness, and a lot of people with those issues end up on the streets and create a lot of issues being homeless, and we don't take care of them like we should. That's my 2 cents worth. There's a lot of other issues that go into a drug use, crime, etc. But that's something that I think a lot of pundits on both sides of the aisle have agreed on. That I get that's those issues and care are underfunded. So again, there's too much to cover here. I'm just going to kind of skim through this, but this is good information to have. Coverage gains. So again, a lot more people. It mandated that everybody have a much more thorough insurance policy that covers more things, but it just means that the cost goes up as well. Whenever you demand more, the cost goes up. So mental health and substance use support, again, I think that's good. And then health for minorities. And have there been improvements in coverage? Have there been improvements in insurance provided? Absolutely. Have there been issues created by the ACA? Absolutely. So it's a double-edged sword. You get more of one thing, you're going to cause problems somewhere else, and that's anything you do. So I'm not. The goal here is not to sit here and bash the ACA law. It is to explain how it works, so people understand. So private insurance, you can go get private insurance anytime. It's changed a lot from 15 years ago when I was raising my kids. It's changed. It's almost not even the same product anymore. So when you talk about private health insurance, then you usually go to a broker or someone, or you can contact someone directly, and they'll offer 1 to 3 year plans. Why do they have 1 to 3 year plans? Because they're so expensive, and they'll cover a lot of things, but they only cover it for a year or at most 3 years. Why is that? Because if the costs are too high and you get sick, you get cancer, when their policy needs to be renewed, they won't renew you. So if you get diabetes, or if you get cancer, if you have a serious long-term health issue, and you become too expensive, the private health insurance is now will tell you to go to Obamacare or the ACA exchanges that are run by each state. So the problem with that is The private insurances can't afford to have people that are high cost. But again, the typical cost for a family is between $1,200 to $1,500 a month. Now, there are plans offered through group plans, and we're going to talk about group plans and other alternatives to just private insurance. But if an individual goes out and tries to purchase a policy through a family, those are the quotes I've been seeing. Those are the costs out there, and they've only gone up with time. So private insurance is really for the rich now. People in the upper middle class that can afford these really, really high rates, and it costs a lot of money. So again, the percentage of someone's income that goes to insurance, if you have private rates, have really gone through the roof. So most people, if you test it all, end up going to the exchanges. So if you go through the exchanges, you go online, you go to whichever your state exchange, and these are all been authorized and approved by the ACA law, and you represent to them what your income is expected to be through the year. So you look at your current income, say, okay, I'm making $50,000 a year. This is the size of my family. This is health insurance we need. So they'll run their computer system and say, okay, based on $50,000 in income, you have 4 people in your home, we're going to say you need to pay $300 a month. And that sounds great, right? That's not the true cost. That's not the true cost. So for a family of 4, you compare that to the private insurance, it would be $1,200 to $1,500 a month. That's the true cost. So if they tell you only need to pay $300 based on your income, the other $900 a month is being picked up and paid by the U.S. taxpayer. So it's being subsidized, heavily federally subsidized, or this wouldn't work. So this is the whole idea behind it, and that there's ways to save money or try to claw back money. But when most people go, and the people that are using these ACA exchanges are the ones that are getting deals on this. So it's very important to understand, let's say for this example, these are hypothetical numbers, of course, but someone goes in, $50,000 income, 4 people in their home, they're quoted $300 a month. That's affordable, it's something they can do. The problem becomes they ask you to go in and estimate your income, or it's based on the last year. So let's say going into 2024, the enrollment periods are November through December. So you can't just enroll any time in the year. You have to do it during the enrollment period. And the idea is to force people to get on health insurance and stay on it throughout the year. Because if people can just sign up for insurance, I have a big procedure coming up, I found out I have cancer. You can't just sign up to it anytime through the year. They want you to already be paying in the system and already be part of the exchanges. And that's any insurance company. They don't want you to just, if you have a pre-existing condition, it's not going to be covered. With the ACA law, they will cover pre-existing conditions, but you have a very narrow window, a couple months, to enroll in the exchanges. And that happens every year. But if you get sick and something happens in between and you don't have coverage, you're on your own. So you have the enrollment period to try to address these. So right now we're already into 2024. But let's say this family enrolled for $300 a month in November of 23, and they have coverage and they're paying $300 a month through 2024. When they file their tax returns at the end of 2024, going into 25 next year, they'll file their tax returns. If their income has increased, so he got a raise, and all of a sudden he's making $70,000, not $50,000. This is where the problem comes in. So he paid a subsidized amount of $300 for the whole year. But then his income went up. And the way this is set up is that they look backwards. They don't adjust it moving forward and say, okay, well, your situation changed. Now this is what you have to pay moving forward based on last year's taxes. They look backwards and say, okay, well, on 70,000 of income, you should have been paying 600 a month. And so when it's $600 a month rather than 300, and the government was paying 1,200, that decreases the subsidy by $300. And so that's 300 a month times 12 that they should have paid. So that probably got a little end of the weeds, but we're going to share another example that's going to make it a little bit easier. So then they're going to hit them with a tax bill of $3,600 plus penalties and interest. So if your income goes up during the year, you need to be very aware that you have to go and report this. You have to go and make adjustments with the ACA, and people don't understand this. Any kind of event that increases your taxable income throughout the year will affect your subsidy and the total cost and what you have to pay for and what the taxpayers, the U.S. government, has to pay for. So anything that affects your income, your taxable income, can affect this. So if you sell a home and it's not excluded, if you sell a property, if you get an inheritance, if you cash out, well, much more common is someone cashes out money out of a 401k. So let's say you get sick or you want a down payment on the house and you pull $100,000 out of your 401k. That's a taxable event that drives your income. So let's say same family, 50,000, making 50,000, and they decide to purchase a home. They get a down payment and they pull out 100,000 for that. Pay off credit cards, whatever. They pull out 100,000 out of their 401k. And that just drove up their, and let's say they pay all the taxes they should when they pull the money out of the 401k. That just drove up their taxable income for that year of 2024 from 50,000 to 150,000. So $150,000, I'm just going to do a little bit of quick math, is 12,500 per month. So that's a huge difference from his previous income. So that's about $4,000 a month to $12,000 a month. So he shows 3 times as much income. So his subsidy, he was paying $300 a month. In this case, if he cashes out a 401k or something, now instead of his subsidy being $300 at the end of the year, they'll look at it and say, well, he should have been paying the whole amount. So then it's $900 a month times 12. Doesn't happen all the time, but now you get this huge increase, and then that leads to an increased tax bill of $10,800. So 3 times the previous one. So again, it can definitely add up quick. It can really surprise people. Something happens and you don't go directly to it. And let's say it happens at the end of the year. It's still going to change your subsidy for the whole year. So you need to understand and say, okay, out of this 100,000, I'm getting money from the exchanges. I need to go figure out how much of the subsidy I need to pay back so I don't get surprised with this huge tax bill that I can't afford. Because most people, when they take money out, they take it out for a specific purpose. A down payment on a home. They could use it for medical bills. Someone gets sick, family member needs emergency money, and then the money's gone. The money's spent, and then the tax bill comes in. Then they're stuck. That's what I see all the time. They get surprised, and they get hit with this tax bill that they weren't expecting. So again, we're going to continue to explain this and hammer home on this and talk about some of the alternatives and ways to deal with this. But again, we're coming up on a break, and we'll be back in just under 4 minutes. And I hope this is informative and helpful to you, and we'll be right back at it shortly. Welcome back, everybody. Thank you for listening or watching here at Taxes Made Easy. Again, I'm really trying to explain how people get hit with subsidies. And one of the things that you need to be aware of when people report an income number, you have to include all sources of income. So what's considered income? If someone's getting Social Security, that's considered income. If any kind of taxable income, you can be drawing off a pension or savings. And if you're pulling it out of any kind of investment fund, annuity, or anything like that, that is considered income, even though it's already your money. If it's been in there, went in pre-tax or anything like that, when you draw those funds out or when you cash out stocks or take money out of mutual funds, that is considered taxable income. So these are some of the things that trip people up and cause them to report incorrect income amounts when they sign up for these exchanges. So any kind of errors in your reporting of income, increases of income throughout the year, or when you have a big event like where you take money out of a 401k, you get a large bonus, you sell a property, and you have still you have funds left over from that above the exclusions. This all causes problems with exchanges when you're getting health insurance through the exchanges. So we had someone come into our business and reviewed our options. We were looking to provide healthcare for everybody, and he told me it doesn't make sense. So wasn't that what businesses do? He's like, well, that's what they used to do. Unless you can get big enough where you do these you get onto these very large group plans, it doesn't make sense. It's just way too expensive for a smaller company to offer health insurance. And he looked at it and he said, look, what I recommend for you is to do these private plans. But for most of my staff, he said, look, get on the exchanges. And he went through and he helped them. And they all got better deals. But again, be cautious when you get a raise, when you get a bonus, etc. And we do give raises and bonuses. You have to be very aware of what that's going to do at the end of the year. So that's the number one thing that trips people up, is not reporting the correct income. And you're guesstimating. They ask you at the beginning of the year, what's your income to be for the whole year? So you have to, whenever there's a change, you have to report it, be aware of that, set aside some money, knowing that this subsidy, in this case, it was a $1,200 subsidy. And that's information they don't share. They tell you, here's your cost, but they don't share if things change what the total subsidy is. So when things change, you need to go talk to them. When you take money out of a 401k, you need to go talk to them. And this isn't easy information to get because they're not set up to help people. The whole goal is enroll more and more and more people because that's what they want to show as far as their numbers. That's what they see as success, that they've enrolled more people into it. The more expansive the program is, the more people they cover, that's what's being termed as success when it comes to these exchanges. But when people run into issues, you can get that information, but you have to get in there, you have to fight for it, you have to fight the bureaucracy to get the correct information. And I could be wrong. Every state is different. Some states are better. I hope I'm wrong. But just be mindful of when you have more income than expected in a given year, you have to be aware of that, or you're going to get a bit surprised and hit with taxes that many people just can't afford. So in this one case, this lady had it happened over a couple of years. She didn't know what was going on, and finally she made adjustments. But by then she owed around $20,000. So key thing, when they were negotiating, the Republicans and Democrats were fighting over this. One of the big fears was that people's wages, people's bank levies, homes would be seized, because of Obamacare taxes or ACA tax, these penalties and taxes. Now the penalty only lasted a couple of years. There's a new election. They got rid of it, but these exchanges, these increase in subsidies, these are still hurting people. These are still affecting people in a very real way. So as part of getting the law passed and getting enough public support for it, or enough people in Congress to sign on for it, they made a change. And one of the adjustments they made was that, okay, we're not going to allow collections on these penalties and the unpaid subsidies. So it's good that if you owe the IRS and you owe these ACA penalties, and again, when I refer to penalty under the law, when it first started, there was a penalty if you didn't have the insurance, and often that was cheaper than getting hit with these either the ACA cost of the ACA, or if you underestimate your income, the increased cost of when your income changed and getting hit with having to pay back the subsidies through the year. So that's also termed the penalty. So the original penalty has gone away. So the taxes, ACA taxes, really are these unpaid subsidies that are coming back and biting people in the rear. So Congress, when they passed the law, the IRS cannot pursue collections actions for these specific things, for the ACA subsidies, unpaid subsidies that end up as a tax on your tax bill. So they're frequently referred to as ACA taxes or penalties. So if that's all you owe, if you owe other taxes, the IRS will just proceed normal. They can come after your bank account, garnish your wages, etc. But for these ACA taxes, they can't. So how do they make sure they get repaid? They will take your refunds. So if you have any refunds moving forward, the refunds will be held and applied to these ACA taxes. So there are other ways that they can be held, but again, it is good to know that, look, they're not going to levy your wages. They're not going to come after you. They're not going to go and seize real property because of this. Now, is it advisable to go and set up some kind of arrangement? Yes, it is. It's absolutely advisable to go set up some kind of arrangement because it can affect your credit. It can affect buying and selling real property. Again, there are other ways that it can still affect you. And again, I wouldn't leave issues sit there and fester. Interest rates have continued to climb. When you take the penalties and interest that get added to unpaid taxes, it can take a smaller amount and really increase it quite a bit for unpaid taxes. And these have the penalty and interest added just like any other tax. So again, be mindful. Don't ignore it. But we're kind of running out of time. So I want to. And what can you do with these? Can you do an offer and compromise on ACA taxes? Absolutely. You can wipe them out through an offer and compromise, and we do that regularly. You just have to be mindful when you fill out the 656, when you fill out the forms, it is considered a separate tax. It's kind of lumped together on your tax bill, but it's a separate tax that needs to be listed separately on the form. And as long as you understand how to do that, you can sell it with an offer. You can do an installment agreement. You can either do a hardship status as well. So all the options to resolving tax issues are available to you. Want to talk about some alternatives. So I mentioned one, and this is some of the larger banks. I think Chase was one of them. A lot of the larger companies in the U.S., they kind of got together and said, hey, health insurance is killing our employees now. And so they, on their own, put together a large group like this. And whenever you get large group insurance, it's much better. It's much more affordable because it's the group. And this is the idea between large health insurance pools. And this is how it was handled before in private health insurance. But it was based on people working for these companies. And they were able to do a very low rate. And so there's been some experiments to that end. The one company that I knew about doing this, they had to end it because it was just too expensive. But some other options that have popped up, you have a lot of cost sharing plans where they're not exactly health insurance, but you pay into it monthly, and the idea is that you get reimbursed for your costs. So if you have you can have a catastrophic rider where they will take care of catastrophic things, but it's not like an insurance company where there's a guarantee that the insurance company's on the hook. It really depends on the solvency of this group, but it's set up differently. It's not a typical insurance. Some of those based on religious principles. If some of those are both based on other groups. So there's some cost sharing plans out there that are much more affordable, or can be much more affordable. There's, like I mentioned, the large group plans. There are doctors that are doing direct pay, where if you pay them a certain amount a year, and it can be fairly reasonable, $1,500 to $2,000, and they will take care of you for the year. You pay them a flat amount for the year. You're their patient, and they will work with you if you need to be settled out. But these are the people avoiding insurance altogether, paying out of pocket, but they already have an arrangement with the doctor in his office, so that you can go in, you can get seen, you can get taken care of. And again, they have cost sharing plans. And because they're working outside of insurance, they can offer much reduced rates. So again, the cost increase of insurance has been really affecting a lot of people, and doctors and practices are trying to find ways around it too. So again, there's a lot of novel things out there. I would be looking for alternatives to traditional insurance if the exchanges aren't working for you, or you just can't afford traditional health insurance. The private plans, the best I saw was 3 years, where you get on, you pay a very high rate for 3 years, and then after the 3 years, if you have any kind of condition, they dump you on the exchanges, where you get to pay outrageous rates if you have a higher income. And so it is definitely a concern for people out there. But one thing to be mindful of, and this is something when you're dealing with the IRS, when you have collections issues, health insurance premiums or costs, if you're in a cost sharing plan or anything like that, what if you're paying for access to a doctor or healthcare, you'll get full credit for that when negotiating with the IRS. You also get full credit for out-of-pocket expenses. So if you are just paying out of pocket, or if you have a lot of ongoing healthcare needs, that can absolutely help. One thing I want to talk about real quick is GoodRx. There have been alternatives popping up where you can go and get prescription costs for much less, and it depends on the prescription, depends on the time of year. But this is something that has been advertised across the country. If you don't know about GoodRx, I think you just go and you just sign up for it. I don't think it even costs anything to sign up for it, but you go in, and when you pick up your prescriptions, my wife does it. I don't even know exactly how it works, but you can get drastically reduced prices on prescriptions by signing up with GoodRx. So there's a lot of, due to the situation, due to the cost, there's a lot of industries or different models popping up to make sure people are provided with good health care and good health insurance. So, health insurance alternatives. So be very mindful of that. Be informed. It can save your family a lot of money in the long run. And again, that's the goal of this show, is to not only help you with your taxes, but help you and your family to save money, to get through these interesting times that we're living in. And again, covered a lot of information today. Again, we're just skimming the top. If you do have health insurance needs, I highly recommend you go and talk to a healthcare professional. There are plenty of professionals out there that help people sign up for plans, to sign up for, discuss their options. And again, some of these are out there in the marketplace. So get online, do your research, and if you need to talk to someone, a health insurance broker, that's something that we can refer you to as well. So again, for you, for your employees, discuss the different options that are available. And there are plenty, there are companies that do offer health insurance for businesses. I think you usually have to have about, they want it to at least be around 10 employees, but then you can sign on to some of these larger group health insurance plans that are much more affordable for you, for your company, to provide those benefits to your employees, which again is amazing. And we're always looking for ways to provide more benefits to our employees. There's some other benefits that we haven't talked about, long-term care, and that's not really related to taxes so much. But again, if you have questions on these ACA penalties and taxes, give us a call, 520-485-7371. Reach out to us at guardiantaxlaw.com or check us out online. And again, this is love to help people beforehand avoid these penalties, but when they happen, give us a call. We can help you out. There are options here, and they're not going to come seize your home unless you do everything wrong. So get good advice beforehand. And I hope everybody has a wonderful Thursday. And thank you again for watching Taxes Made Easy. We try to be informative. And we're going to be posting this with all the links that we used on our YouTube channel as well. So if you want to look up the articles, just check us out on YouTube as well. And so thank you again for watching and have a great day.